How will I be kept safe if I take part in research? Our first 3 videos talked about what research studies are, how they work, and about consent. This video talks about what researchers do to make sure you are safe when taking part in the research study. Ethics is when we talk about right or wrong. Before people can take part in health and social care research studies, the studies must be approved by the Research Ethics Committee. A Research Ethics Committee decides what research is acceptable and safe. Research Ethics Committees include patients and carers. Is this study the right thing to do, or is it not clear? Some may not be the right thing to do. A Research Ethics Committee can refuse to approve a research study. If the study team wants to change things during the study, it must go back to the Ethics Committee and ask for permission again. Some studies do offer people payment to take part, but this is unusual. Usually people are not paid to take part in research. You should not be left out of pocket, however, because you have agreed to join a research study. For example, the travel costs of extra visits to a clinic should be repaid. So extra childcare or carer costs should be paid as well. Sometimes people can't join a study, and this will be explained as well. For example, the treatment the study is testing may harm you if you are pregnant or thinking about becoming pregnant. The research team will very carefully explain about any risks if you take part in the study. For example, you might be asked to take a new medicine instead of your usual one, or take a different dosage of your usual medicine. The new medicine will have been checked to make sure that it is safe, but this will have been with only a small number of people. Because research studies look at lots of people taking new medicine, the research team will not know everything about side effects. This is why carefully choosing to take part is very important. Only the research team will see your personal information, such as your name and your health or medical condition. Sometimes the research team will ask if it is okay to let your GP know that you have joined the study. The information collected about you during the research study is kept very safe. Most personal research information is stored on secure computers. Some information may be in locked cabinets that only the research team can open. Blood and tissue samples are safely stored in what is called a tissue bank. An example of a tissue sample is when a small piece of your skin is removed and examined under a microscope to see if there is cancer. Importantly, the research makes information about you anonymous as soon as possible. This means your personal details are removed and you are given a study ID number. This means that you cannot be identified by anyone looking at the study results. The study results are published as medical and scientific articles. They are talked about at conferences and are printed in research journals. Some research studies are reported in the news.
Remember, taking part in research is a personal decision and always your decision. You are under no pressure to take part in research.
And if you do join a study, you can stop taking part at any time. Even the study has no effect at all on your usual health or social care. People who have taken part in research studies say they have a really good experience. When they were last asked, 91% of adults and 89% of children and young people in England said they would take part in research again. This is what someone said about the research study they took part in 2024. I felt that I could raise any questions or concerns and not be thought of negatively. In all honesty, the team has made this whole experience fantastic and even enjoyable. Enjoy taking part in research.